Last week, the CEO of a major healthcare provider was killed right on the street in New York.
But what transpired in the hours following has created a shocking new headline. Stories of frustration, not necessarily pointed at the shooting, but instead at the state of our healthcare. Dr. Natalie Gentile joins us for an important Wellness Wednesday discussion. And we want to start by saying, for people watching at home, we know that you know what's best for your family and your healthcare needs. And we are in a time right now where there are choices and options. But Dr. Gentile, it does feel like the temperature is rising in all of this. And this kind of being this catalyst for a larger conversation.
Yeah, I think this is a symptom of a bigger issue, like we say in medicine, right? We should not be necessarily celebrating that somebody was killed, but this is opening conversations that maybe aren't as frequently being had prior.
Absolutely. And it really feels like the first issue in a long time, that it doesn't matter where you sit on the left or the right, red or blue, that you want to be a part of it or are at least reading it. So from a medical healthcare professional, what do you consider broken, as though you have also worked in it from the day you started?
Certainly. So I always say, you know, our healthcare system is broken, but from their perspective, it's working just fine. It's a profit-driven industry, right? The health insurance companies and the health systems are profit first, not patient first. And I think we can safely say that pretty much across the board, right. In a lot of our country. So from that perspective, they're working just fine. From our perspective as consumers and as those of us working in the healthcare systems, it is completely broken.
Yeah, I mean, I've seen a lot of videos, even from the perspective of medical professionals who are saying, you know, they're an hour out of doing major surgery and they're getting phone calls from insurance companies saying, well, have you tried everything? So we know even from the standpoint of a medical professional, it can be very difficult when you have all of these other outside influences coming into what you're doing. And you pointed out that one of the big issues is administrative overhead. This is causing a lot of issues.
We have a very bloated healthcare system where we have to have such significant administrative overhead to run insurance claims, to, you know, take care of the massive influx of patients with such little staffing. I mean, if you see the staffing issues across the board in hospitals, for example, in offices, how are we supposed to keep up with the demand in needs? And then if you add on top of that the prior authorizations, which are a massive, you know, resource suck, the time suck for offices. This administrative burden alone can take down the quality, accessibility of care that we deserve.
And this was kind of a three-pronged system for you. And I know that kind of goes back to what you just said, the complex insurance plans and the fact that everyone has different coverage and every company is different. I mean, that has to be another hoop to jump through.
Our insurance and access to it is tied to employment for so many people. I was just talking with a patient the other day who lost her job. Now what? She can go to Cobra and spend $800 a month for herself for health insurance. She can go on the marketplace and try to navigate that in a way that how is anybody supposed to understand it? Right. You know, it's just so insurmountable for so many people for such a basic human need, which is healthcare.
Right.
Absolutely.
And another thing that, you know, we don't often think about until we need that prescription, but the prescription prices are so heavy. This is something that's even impacting, we've done a couple of reports here on these smaller mom and pop style pharmacies.
Yeah.
Oh, certainly. I mean, patients can't afford their medications. So if you're then choosing between a medication and groceries, what are you supposed to do?
Right.
Yeah.
Right.
And when did you, I don't necessarily want to say, you know, what was the straw that broke the camel's back, but when did you decide to go into private care? Because I know that's obviously a huge step.
Yeah, I left the insurance-based model of care when I realized how bloated the system was and how we need time with patients to make actual sustainable change in their long-term health. And I, as somebody who's gone through the amount of training that I have, like my fellow physicians, deserve to have a say in how that's going to go. Right. And we need to work together with our patients without so many middlemen in between.
Right.
We're seeing this too, not just for adults, but there's pediatric direct care models that exist now. I mean, we are seeing this added in as another option now.
Certainly. I think people talk a lot about the scalability of the direct care type model, but the reality is, how's it going for us right now with a massively scaled system? We have to have multiple options for consumers to, you know, use their health care and engage in it. And this is a massively growing model that more and more people, both consumers and healthcare workers, are becoming aware of.
Absolutely.
Such an important conversation. Thank you so much for
really
this today.
Is. Thank you.
Really interesting.
If you're interested in learning more about direct care physicians of Pittsburgh or Rebel Wellness, we're going to have more information on our website, kdk.com/talkpittsburgh.